Hello everyone, today is August the 19th. I'm Dr. Adam London, Director of the Kent County Health Department, here for this week's COVID-19 update. Here in Kent County, we're currently reporting 7,150 diagnosed cases of COVID-19. We're seeing an average right now of about 32 new cases per day. That number continues to trend downward. It's a very positive thing. Speaking of positivity, our positivity rate also continues to trend downward. As of right now, we're at 1.7% as an average over the last week of our tests are coming back positive for COVID-19. These are great signs for us here in Kent County. However, there are still warning signs that this has not gone away. On the southeast side of the state, they continue to see much higher positivity rates, ranging between 4 and 7%. That's a concern for us everywhere, in that we continue to see these waves of cases. We know that there are more variables, there are more cases to come. Certainly as school restarts, as the weather cools down again, these are factors that are likely to make it a higher risk and easier for this virus to spread once again. So we need to continue being careful, we need to continue being smart and making it difficult for this virus to spread. As of now, 5,873 people have recovered from COVID-19 here in Kent County, and we're at 154 deaths in total here in Kent County. We've had 3 deaths so far in the month of August, so the pace of our deaths has slowed down dramatically here in August. That's the best news of all. Most of our deaths happened in June and in July, and so we've seen that pace slow down a great deal. That's largely because our healthcare providers are learning very powerful lessons from other areas. We're getting new tools, and we're seeing that our healthcare systems are not overrun. And that's one of the most important factors in keeping our death numbers as low as possible. So last week I talked a little about masks in schools. And I want to reiterate that here at the Kent County Health Department, we do recommend that all students who are going to in-class instruction in school should be wearing a facial covering. Now we know that kids in K through 5 are not required to wear a facial covering. However, it is our recommendation that they should be wearing masks as well. Now, some people have children that are medically cannot tolerate wearing a mask. We recommend for those kids, this is a recommendation, if you are in a situation where you have a child that for whatever reason is not capable of wearing a mask, then I want you to strongly consider the virtual option. Also, if you have a family member at home who has a serious underlying health condition, you also might want to put some more consideration into the virtual option in order to protect everyone in the family. And I also want to implore you, everyone, that this is going to be a difficult lift for us going back to school. And it's going to be imperfect. And we're going to see people that many are wearing masks, some that are not wearing masks. And I want to encourage you to avoid passing judgment on other people. There's way too much anger already in our community and across the nation. Too many people have turned this into a culture war issue. I think it's really unfortunate. We can't know everyone's circumstances, and we know that kids' behavior and expecting them to wear masks all the time is going to be very, very difficult. So please, I implore you, please take a step back. Try not to overreact to other people's choices, whether they be wearing masks or not wearing masks. We all need to do what we can to protect ourselves and protect others, and be as patient and as generous with others as we can. I also remind you that this is Vaccine Awareness Month, and we have seen our vaccination coverage numbers drop a bit during this pandemic. That's not a surprise. Many appointments have been canceled. People haven't been going to the doctor as much as they normally would have. It's very important that we don't see an outbreak of measles or pertussis or some other vaccine-preventable disease during this time of pandemic with COVID-19. So if you have children, strongly recommend that you call your doctor's office, make sure their vaccines are up to date. If you don't have a family doctor, you can contact us here at the Kent County Health Department, and we can check for you, and we can help to make those arrangements so that your child or yourself can get the vaccines that you need in order to make it difficult for not just COVID-19, but all these other viruses and diseases to spread. Right now, it's incredibly important that we keep infectious disease as low as possible in our community so that we don't overwhelm our hospitals and we keep human suffering at a minimal during this difficult time. So that's all for today. I'm Dr. Adam London with the Kent County Health Department, encouraging you to stay positive, stay heroic, and stay healthy, and I'll talk to you again very soon.